close your eyes for a moment and imagine this. You're walking your grandchild through the park. The sun is gentle, the grass soft beneath your feet. But just minutes later, your knees begin to wobble, your calves cramp up, and you have to stop and lean against a bench. Your grandchild looks up and asks, "Grandpa, why aren't we walking anymore?" And you smile, hiding the truth. "My legs are just a little tired." For many older adults, there's nothing more disheartening than when your own legs stop cooperating. We can accept gray hair and fading eyesight. But when our steps slow down, so does our sense of freedom. And here's something you might not realize. A major reason behind it is the lack of essential vitamins and minerals, the silent heroes that nourish your muscles, nerves, and blood vessels every single day. Without them, nighttime leg cramps become common. Without them, balance becomes shaky and falls become more likely. And without them, independence slowly slips away, often without warning. But here's the good news. You can change all of that simply by adding 9 key nutrients that geriatric specialists in the US recommend. In today's video, you'll discover the vitamins and minerals that keep your legs strong, your nerves firing quickly, and help prevent cramps, the warning signs your body gives when it's running low, and the simple, affordable foods you can find right in the US to get what you need. No expensive supplements required. If you want to walk with confidence, stand up with ease, and sleep peacefully through the night without sudden cramps, then don't miss a second of this video. Vitamin D. Sunshine for stronger legs. Picture your legs as the 2 pillars holding up your entire body. But if the foundation is weak, the whole house can shake. And vitamin D is the cement that connects your bones and muscles. In older adults, a lack of vitamin D doesn't just make bones brittle. It also weakens the muscles, especially in the thighs and calves. The result? You're more likely to fall, suffer muscle pain or cramps, or struggle just to stand up and sit down. And here's the scary part. Most people over 60 in the US are vitamin D deficient and don't even know it. Signs you might be low on vitamin D. Frequent leg cramps at night or while walking. Feeling like your legs are getting weaker, even though you stay active. Balance issues, especially when going up or down stairs. Dull, unexplained aches in your hips, thighs, or calves. Why are seniors more likely to be deficient? Older skin produces less vitamin D from sunlight. You may use sunscreen, wear wide-brimmed hats, or simply stay indoors more. Diets often lack vitamin D-rich foods, especially when cutting dairy or trying to lose weight. Testing. Many seniors have trouble absorbing vitamin D or have liver-kidney issues that affect how it's processed. Vitamin D food sources, but most people don't get enough. Salmon, mackerel, sardines. But how often do you eat fish weekly? Fortified milk. Yet many avoid milk due to lactose intolerance, weight concerns, or simply not liking it. Eggs, beef liver, sun-exposed mushrooms, all helpful, but not easily consumed in large enough amounts. That's why most medical experts in the US agree. Seniors should take daily vitamin D supplements to maintain muscle strength, better balance, and protect against osteoporosis. Recommended dosage. Adults 60 plus should aim for 800 to 1000 IU per day, unless otherwise advised by a doctor. Many senior multivitamins include this dose, but check the label carefully. Geriatric. Tip: Vitamin D absorbs best when taken with a meal that includes healthy fats, like eggs, avocado, or a drizzle of olive oil. Why you should start prioritizing vitamin D today. You can't exercise if your legs constantly ache. You can't travel if every step feels like a fall risk. You can't be independent if you need help getting out of bed every morning. Vitamin D isn't a miracle cure. But without it, your legs may silently suffer. So start today. Remind yourself, I take vitamin D not just to strengthen my bones, but to walk confidently every single day. Magnesium, the silent warrior against leg cramps. Have you ever been fast asleep when suddenly, bam, a severe cramp hits your calf? Or you're out for a walk and your leg muscles tighten up like a locked gear, forcing you to stop immediately? It's probably not due to lack of exercise. It's probably not your shoes. Chances are, you're low on magnesium. Magnesium, the muscle and nerve balancer. Magnesium isn't as famous as calcium or vitamin D, but for seniors, it's an unsung hero. Here's what magnesium does. Helps muscles contract and relax smoothly. Aids in transmitting signals from nerves to muscles. Supports over 300 biochemical reactions in the body. In short, low magnesium leaves your muscles tense like a drawn bowstring, prone to cramps, twitching, and unexplained fatigue. Warning signs. You may be magnesium deficient. Nighttime leg cramps, especially in the calves. Tingling, numbness, or small muscle twitches in the thighs. Irregular heartbeat or unexplained restlessness. Irritability and trouble sleeping. Magnesium-rich foods. You can easily add to your diet. Pumpkin seeds, sunflower seeds. Dark leafy greens like spinach or kale. Avocados, whole grains. Dark chocolate, over 70% cocoa. Pro tip, try a magnesium smoothie in the afternoon. Blend avocado, banana, unsweetened cocoa, and almond milk. A delicious way to recharge. Who's most at risk for magnesium deficiency? Adults over age 65. People with diabetes or high blood pressure. Those taking diuretics, antacids, or long-term antibiotics. Anyone on a low vegetable or long-term restrictive diet. Safe daily intake. Seniors typically need 320 to 420 milligrams of magnesium per day. Look for magnesium citrate or glycinate. These forms are easy to absorb and gentle on the stomach. Important. If you have kidney issues, talk to your doctor before supplementing. Excess magnesium can be harmful when kidney function is impaired. Magnesium, your key to better sleep and relaxed legs. Did you know? Magnesium helps promote deep, restful sleep and reduces nighttime muscle spasms. That's why many US doctors say, if a senior complains about cramps and poor sleep, try magnesium before reaching for prescription meds. Take action, one step at a time. If this message makes you think, wow, that sounds like what I'm going through, that's a good thing. It means you're listening to your body. Hit the subscribe button if you'd like to keep learning practical science-based tips created specifically for older adults. People like you who are committed to living healthy, strong, and independently every single day. Vitamin B12, strong nerves, steady steps. Imagine this. You're taking a peaceful walk in the park, but suddenly, your feet can't quite feel the ground beneath you. You feel tingling, numbness in your toes, or a strange sense of unsteadiness. Most people chalk it up to aging, but in reality, one of the most common deficiencies in seniors over 60 is the real culprit: vitamin B12. Why is B12 so important? Think of B12 as the insulation for your nervous system. It helps maintain the myelin sheath, a protective coating around your nerves, like insulation on electrical wires. Produce red blood cells to prevent anemia. Boost energy and reduce chronic fatigue. Support memory and cognitive function. Without enough B12, your nerves start misfiring, sending delayed or faulty signals, leading to numbness, pain, or imbalance. Warning signs of B12. Deficiency. Tingling or numbness in fingers or toes, like ants crawling. Slight balance issues or tripping while walking. Constant fatigue, even after a full night's sleep. Trouble concentrating or memory decline. Red, sore tongue or a burning sensation in the mouth. Why are seniors more likely to be B12 deficient? As we age, the stomach produces less acid, making it harder to absorb B12 from food. Common medications like antacids, metformin for diabetes, or long-term antibiotics can block B12 absorption. Low intake of animal products like meat, fish, eggs, and dairy, all major sources of B12. That's why US geriatric specialists often recommend routine B12 testing for adults 60 and older, especially if they experience foot numbness, dizziness, or memory issues. Top B12-rich foods. So, beef liver. Just one small piece can cover 2 days' worth. Salmon, sardines, mackerel, eggs, milk, and cheese. Fortified foods like B12-enriched cereals. If you're vegetarian or vegan, B12 supplements or fortified foods are a must. How to supplement B12. Typical supplement dose: 500–1000 mcg per day, sublingual lozenges or oral tablets. For severe deficiencies, doctors may recommend B12 injections. B12 is water-soluble, so excess amounts are flushed out, but it's still wise to consult a healthcare provider for the right approach. B12 supports more than just your legs. It protects your brain. Multiple studies in the US have shown seniors with healthy B12 levels are less likely to experience confusion, early memory loss, or dementia. So if you want to walk with confidence and think clearly every day, start with one simple habit. Make B12 a part of your daily routine. Vitamin K2, the calcium gatekeeper for strong bones and clean arteries. When people talk about vitamins for bone health, the spotlight usually goes to calcium and vitamin D. But there's one unsung hero that geriatric doctors in the US now call the missing link in protecting both your bones and your blood vessels: vitamin K2. K2's special role: making sure calcium goes to the right place. You can take calcium every day, but without enough K2, that calcium may not end up in your bones. Instead, it might build up in your arteries, heart, or soft tissues, leading to dangerous complications. Think of K2 as a gatekeeper. It directs calcium into your bones and keeps it out of places where it could cause harm, like your arteries. Without it, your bone supplements may do more harm than good. 2. Main forms of K2. MK4, fast-acting, but requires frequent doses. MK7, longer lasting and better absorbed, commonly found in fermented foods like natto. Studies from Europe and the US show seniors who regularly take MK7 have higher bone density and a lower risk of fractures, even if they already take calcium and D3. Signs you might be low in vitamin K2. Osteoporosis or fractures from minor falls. Arterial calcification visible on heart CT scans. Unexplained high blood pressure. Joint stiffness or pain, even with calcium and D3 supplements. K2-rich foods you should try. Natto, Japanese fermented soybeans, one of the highest MK7 sources. Goose liver, egg yolks. Aged cheeses like Gouda, Edam, Brie. Butter and whole milk from grass-fed cows. Not a fan of these foods? MK7 supplements, 100 pound 200 mcg day, are a popular and effective choice in the US and Europe, especially for older adults. Important note: if you're taking blood thinners like warfarin, talk to your doctor before supplementing with K2. It can interfere with how your medication works. A question worth asking: are you sure the calcium you're taking is actually reaching your bones? Or could it be silently clogging your arteries? If you've ever heard of someone having a heart attack despite taking bone supplements, this might be the missing piece of the puzzle. A final word for you. Taking the right vitamins isn't just about checking the box. It's about understanding what your body truly needs, using them wisely, and choosing what works best for you. Vitamin K2 may be small, but it's mighty. And for seniors who want stronger bones and healthier arteries, it could be a game changer. Top of form. Bottom of form. Vitamin B1, thiamine, restoring coordination and balance. Imagine this. You're taking a peaceful walk around your neighborhood when suddenly you feel a bit disoriented. Your steps become uneven. At times, you find yourself reaching for a wall or gripping the stair rail, even though you're not dizzy. It's not just a muscle issue. It could be a sign that your motor nerves are losing communication with your legs. This is where vitamin B1, also known as thiamine, comes in. How does thiamine work? Vitamin B1 acts as an energy shuttle station inside your nerve cells, especially those responsible for movement. It helps carry signals from your brain to your spinal cord, then out to your thighs, calves, and feet. Without enough B1, those signals slow down, get interrupted, and over time may lead to nerve cell degeneration. The result? You might start to notice an unsteady or awkward gait, subtle trembling when walking faster, tingling or pins and needles in your feet, and even minor falls that can become serious. Who's most at risk of B1 deficiency? Seniors with diabetes, especially those taking metformin, which reduces B1 absorption. Regular alcohol drinkers, those with low-protein diets or who live alone and eat poorly. People on long-term diuretics, commonly used for high blood pressure or heart issues. According to the CDC, over 1/3 of seniors in the US have suboptimal thiamine levels, and most don't even realize it. How to supplement smartly. Thiamine is naturally found in lean pork, sunflower seeds, whole grains, lentils, soybeans. But keep in mind, cooking and storage can destroy a lot of the thiamine in food. That's why for adults over 60, experts recommend taking a daily B-complex vitamin that includes thiamine, especially if you're feeling fatigued, unsteady, or experiencing mild tremors. A major bonus of thiamine. New studies from Harvard suggest that high-dose thiamine, 100/300 mg each day, under medical supervision, can help reduce nerve inflammation in diabetics, a key cause of leg weakness, numbness, and dangerous falls. Plus, thiamine supports cardiovascular function, helping your heart pump blood more effectively to your legs, giving you the confidence to walk strong and steady every day. Bottom line, vitamin B1 may be small, but for older adults, it plays a big role in keeping every step secure and every movement in sync. Vitamin B2. The silent energy source. Behind every steady step. Did you know that every step you take activates millions of energy-producing cells all at once? Behind the strength and stability of your stride, from your muscles and nerves to your circulatory system, lies an unsung hero, vitamin B2, also known as riboflavin. Why B2 is so important for older adults? Vitamin B2 is essential for cellular energy production, especially in muscle tissue and peripheral nerves. Without enough B2, your muscles tire more easily, even during light walking. Your motor nerves may react more slowly. Recovery after falls or injuries becomes noticeably slower. A 2021 study by the U.S. National Institute on Aging found older adults with higher B2 levels in their blood had significantly better balance and a 37% lower risk of falling. Signs you might be low on riboflavin without realizing it. Dry eyes, blurry vision, or light sensitivity. B2 helps protect the cornea. Sore tongue, cracked corners of the mouth, or persistent throat irritation. Unexplained fatigue, especially after physical activity. Morning stiffness or a tight feeling in the ankles or feet. B2-rich foods to add to your weekly menu. Milk and dairy products, cheese, yogurt. Eggs, especially the yolk. Organ meats, beef liver, chicken liver, goose liver. Whole grains, almonds, mushrooms. But keep in mind, vitamin B2 is easily destroyed by light and high heat. That's why, even with a decent diet, many older adults experience long-term, mild B2 deficiency without noticing it. How much B2 do you need? Average daily recommendations. Men over 60, 1.3 mg day. Women over 60, 1.1 mg day. If you're living with chronic conditions, diabetes, heart disease, anemia, talk to your doctor about taking a B-complex supplement that includes B2. It's safe and easily absorbed. A surprising bonus of B2, migraine relief. According to the Mayo Clinic, high-dose riboflavin, 400 mg a day, has been shown to reduce the frequency of migraines, a common complaint among seniors who live alone or struggle with sleep issues. And fewer migraines means better mobility, which is key to preserving strong, steady legs as you age. Bottom line, vitamin B2 might not get much attention, but it's working behind the scenes, powering every movement, supporting your nerves, and helping you stay on your feet longer. Vitamin E, the antioxidant shield. that protects your leg muscles and blood vessels. Imagine the muscles, blood vessels, and nerves in your legs as finely tuned strings on an instrument, working smoothly, precisely, and reliably every day. But over time, rust starts to appear. Not something you can see, but something that happens inside. Free radicals attacking your cells, leading to aging, silent inflammation, and muscle decline. That's when vitamin E plays a critical role. Why is vitamin E so important for seniors' legs? Vitamin E is the most powerful fat-soluble antioxidant in the body. It helps prevent muscle cell damage, protect the membranes of motor nerves, support healthy, flexible blood vessels for better circulation. When your blood flows smoothly to your knees, calves, and feet, you'll notice fewer leg cramps, easier, more fluid movement, faster recovery after sitting or lying down for long periods. What happens if you're deficient in vitamin E? Among older adults, low vitamin E levels may cause muscle weakness or mild trembling, loss of balance when going downstairs, slower reflexes, dry, less elastic skin, an outer sign of deeper deficiencies. A study from Oregon State University found that seniors with low vitamin E levels were 2.5 times more likely to experience repeated falls within a year. Best sources of vitamin E. You can get vitamin E from food sources like almonds, sunflower seeds, extra virgin olive oil, avocados, asparagus, spinach salmon, mackerel, and tuna. For people over 60, a daily intake of about 15 milligrams, 22.4 IU, is considered safe and effective to maintain muscle and tissue health, according to the USDA. Caution: high doses of vitamin E may interact with blood-thinning medications. Be sure to talk to your doctor if you're taking aspirin, warfarin, or statins. Bonus: vitamin E improves blood circulation to the legs. Vitamin E helps reduce blood viscosity, making it easier for blood to reach distant areas like your feet. This is especially valuable for seniors who are less active or experiencing early signs of varicose veins. Vitamin A, the unsung hero that protects your nerves and foot vision. Most people know that vitamin A helps maintain good vision, but what many overlook is this: the sharp sensation on the soles of your feet, your quick reflexes when tripping over something, or the pain you feel when stepping on something sharp, all rely on peripheral sensory nerves. And vitamin A plays a critical role in protecting and regenerating these nerves. Why do seniors need vitamin A for healthy feet? Vitamin A helps maintain myelin, the protective sheath that insulates nerve fibers, allowing smooth nerve signals from the brain to your feet. Support the repair of damaged peripheral nerves, especially important for those with a history of diabetes or foot neuropathy. Promote healthy skin on the feet, preventing cracked heels and skin infections, thanks to its role in epithelial repair and skin barrier protection. When foot nerves are weakened, you're more likely to lose sensation or feel numbness in the feet, fall when walking on slippery or uneven surfaces, develop foot ulcers without noticing, especially dangerous for those with diabetes. What can happen if you're deficient in vitamin A? Night blindness or difficulty seeing in low light, dry, cracked skin, especially around the heels. Weakened immune system, slow healing of cuts or infections on the feet, slight loss of sensation in your toes. Best sources of vitamin A for older adults. Foods high in provitamin A, beta-carotene, carrots, sweet potatoes, pumpkin, kale, mangoes, cantaloupe, papaya. Foods rich in active vitamin A, retinol, beef liver, chicken liver, eggs, whole milk or fortified dairy products. Daily recommended intake: men 900 mcg day, women 700 mcg day. Be careful not to overdo it. Vitamin A is fat-soluble and stored in the liver, which means excess intake can accumulate and lead to toxicity. Too much vitamin A may cause nausea or headaches, insomnia, bone loss with long-term high-dose use. Unless you have a severe deficiency, it's best to get vitamin A from whole foods or low-dose multivitamins that include it along with other nutrients. Vitamin C, the repair bridge for tendons, muscles, and blood vessels in your legs. When you think of vitamin C, you probably think of boosting your immune system. But few people realize that vitamin C is essential for repairing connective tissues, improving blood vessel elasticity, and reducing leg soreness after physical activity. Why is vitamin C especially important for seniors' legs? It stimulates collagen production, a key component of tendons, ligaments, and knee cartilage, strengthens blood vessel walls, helping prevent varicose veins, bruising, and swelling in the legs, reduces mild inflammation and muscle soreness after light activities like walking or gardening, improves iron absorption, crucial for older adults who often experience fatigue or muscle weakness due to anemia. Signs you might be low on vitamin C. Muscle or joint aches even after light movement, easy bruising on the legs or slow healing of scratches, bleeding gums or weakened teeth, frequent tiredness or low energy. Natural sources of vitamin C. Ideal for seniors: citrus fruits, oranges, grapefruits, strawberries, kiwis, red bell peppers, broccoli, kale, tomatoes, papaya, cantaloupe. Recommended daily intake: men 90 mg day, women 75 mg day. Vitamin C is water soluble, so it's unlikely to build up to toxic levels. However, avoid exceeding 2000 mg day to prevent digestive upset or kidney stone risk. If taking a supplement, choose a multivitamin with added zinc or bioflavonoids to boost absorption and effectiveness. Special bonus: vitamin C is the connector vitamin. It helps other key players like collagen, iron, vitamin E, and vitamin D work more efficiently. For seniors who experience joint pain, tired legs, or frequent bruising, this is a must-have vitamin. When we're young, we don't think much about our legs. We walk, run, work, as if that strength will last forever. But as the years go by, even a small muscle cramp, a slight loss of balance, a minor slip on the stairs can make us pause and ask, am I still as steady as I used to be? The truth is, leg strength doesn't disappear overnight. It fades, little by little, if we neglect it. But the good news is, it can return if we start caring for it the right way. The vitamins you've just learned about are not magic, but they are powerful tools backed by science to help you rebuild the strength, balance, and flexibility in your legs, the foundation of your independence, your freedom, and your dignity as you age. Remember, every strong step you take today is a promise to yourself for a more active, independent, and safer tomorrow. If you found this video helpful, please hit that subscribe button so we can continue walking this journey together, not just for healthier legs, but for a fuller, stronger life every single day.